Let's look at the next set. There's a hospital, XYZ Hospital, a renowned healthcare facility, has been facing significant challenges in providing quality healthcare services due to a shortage of doctors. So what's the problem here? There is a shortage of doctors, so we're not able to give good care. A good hospital, it's a doctor who makes the hospital. After all, the person treating you is the doctor, and this hospital is unable. It's a good hospital, it's a renowned healthcare facility, but now it's having problems in providing good healthcare because of shortage of doctors. They don't have enough doctors. The hospital administration is deeply concerned about the impact on patient care and is determined to find effective solutions. Let's find a solution to this problem. They have analyzed the situation and have identified the key factors contributing to the shortage. 1. What are the reasons for the shortage of doctors? Okay, let me just have a swig of water. Excuse me. First, the hospital has experienced a surge in patient demand and a growing population in the surrounding area, resulting in increased pressure on the existing medical staff. So, number of patients has increased suddenly. So, earlier you had, let's say, 10 doctors, they were enough for the patients, and suddenly the number of patients has gone up. So, obviously, the number of doctors are falling short. Secondly, the hospital is located in a remote region, and because of that, it is less attractive for doctors seeking career opportunities in urban areas. It's situated in a remote place. Not all doctors want to come to that remote place. Those who want to stay in urban areas, want a career in the city, are not inclined to go and work in that hospital. Lastly, this is the second reason. So not many doctors really want to come to your hospital because they want something closer to the city. Last is the retirement of several senior doctors in the coming years will exacerbate the shortage, will make this shortage worse, and also mean loss of valuable expertise. To address these challenges and ensure the efficient delivery of healthcare services, the hospital administration is considering different strategies and recruitment options. Let's see what is that. Which of the following strategies should the hospital adopt to address the shortage of doctors? That's the first key. The objective is we need to overcome the shortage of doctors and maintain quality healthcare services. They can't just hire any doctor. They have to get the best doctors to get over the shortage, because they have to also maintain quality healthcare services. Correct? So let's look at the options. Collaborate with medical schools to establish a medical residency program with the help of senior doctors and attract fresh talent. So you have senior doctors who are going to teach the residency program. Residency program would be people who are already, reached a level. Resident medical doctor has already finished his basic undergrad. And so these senior doctors will go to these medical schools and they will train resident doctors. And just because a senior doctor is doing this training program, more fresh talent will be attracted to medical colleges and you're going to have more doctors. Good. Enhance the hospital's infrastructure and facilities to create an attractive work environment for doctors. Now, the problem is not that the hospital itself doesn't have infrastructure. The problem is the location of the hospital. Doctors don't want to go there because it's somewhere in the remote area. This is not going to work. Implement telemedicine to provide remote healthcare consultations and support. This is for people who are unable to go to the hospital, or the hospital is unable to reach the people in remote areas. That is not the problem. The problem in the hospital is there are a lot of patients coming to their hospital and they don't have enough doctors to take care of those patients. Right? This telemedicine thing will work during a pandemic when somebody can't come, the doctors cannot go, personal one-on-one touch is not there. then it works. But here, that is not the problem. It's not like patients can't come to the hospital. There are more than enough patients than they can take care of. That is the problem. So 3 is not addressing the issue. Develop partnership with neighborhood hospitals to share resources and medical professionals. Where is the question of sharing? They don't have enough doctors themselves, and then where is the question of sharing? And it didn't say they don't have resources. So D doesn't work. Offer competitive salary packages and incentives to attract experienced doctors to the hospital. Maybe, but nothing has been said about the salary being low and doctors not coming there. They can offer double, but the key here is doctors who want to serve in the city itself. So if you can do this, you can attract fresh talent and probably encourage some of them to come. So between A and E, A is the right one to attract fresh talent so that the shortage of doctors is not there. Those who don't mind coming and working in your remote hospital, plus you also are trained, so they also are trained by the best in the industry. All right, next question. In order to ensure the highest level of patient satisfaction and quality care, which of the factors should the hospital prioritize when recruiting new doctors? Now, objective is patient satisfaction, quality care. All right. Specialization in the most demanded medical fields to meet the specific needs of patients. This is only a small number of patients who require that much specialized attention. The question is talking about overall patient satisfaction. We are not sure. We are talking of those very, very difficult cases which requires super specialization. So A is not relevant. We are not sure what is the assumption here. A is making the assumption the hospital is not able to treat rare cases, not able to treat very complicated cases. The doctors are not qualified enough. That's not the challenge. Challenge is not doctors not being qualified enough. The challenge here is you want to recruit doctors taking two things. They should give good care, and they should ensure that the patients are happy and satisfied. Strong leadership and management skills. It didn't talk about hospital administration. Proficiency in the use of advanced medical technologies. Again, the key is not that the doctors are not qualified to handle advanced medical technologies or that they have outdated knowledge. That's not been given. Empathy and compassion towards patient to provide personalized and patient-centered care will ensure patient satisfaction and quality care. All right, professional development again means that they are lagging behind. Therefore, D is the only one which suits the objective given in the question. Question 9. XYZ hospital wants to reduce patient waiting time and improve efficiency in its operation. You have an appointment at 9, you're made to wait till 11. It wants to reduce that. Second, efficiency in its operation. Patient comes, sees the doctor, gets the test done and goes away. The process is more streamlined. So one, waiting time is reduced, process is streamlined. Which option would help that? That's what the question is asking. Hire additional administrative staff to handle paperwork and streamline administrative process. Is the patient waiting time due to shortage of administrative staff? Streamline administrative process maybe, but patient waiting time is more patients than doctor or something wrong with the way the appointment has been scheduled. Okay, that will not help with hiring more administrative staff. Okay, streamlining the administrative process, yes, but hiring additional administrative staff may not work. Increase the number of specialist clinics. No, we are talking of the existing ones. Increase communication among medical teams handling various cases. Has he said that there is a discrepancy, there is some sort of a gap of communication between medical teams? It says waiting time, and generally when we talk of waiting time for an appointment with a doctor is what you're talking about. Implement a digital appointment scheduling system. minimize waiting time. That looks good. Collaborate with local community health centers to provide, it says it's not able to. Alright? Okay, so the answer is obviously D.